Quality in Healthcare, chapter 67, chapter 61, page number 409. Those who have the textbook, page number 409. So, quality in healthcare. Quality can be defined as the degree of excellence that in the simplest way. Okay. And it is a dynamic phenomenon. What quality was considered 10 years back is not the quality right now. It is dynamic. It changes with time. Okay. With place as well. What do you consider quality as in India may not be the quality in Japan. Okay. So who determines the quality for a particular product service or for a particular period of time or place? Who determines the quality? It's the customer who determines the quality. Okay. Page number 409. So what is quality today may not be the quality of tomorrow. Okay. It changes. It keeps on changing. Okay. So features of the product or service which the customer buys or intends to buy must possess the requisite features, meaning they should able to fulfill the basic objective of buying the product or service. For example, if you buy a thermometer and if the thermometer is not showing you the correct temperature, so it has failed as a product, right? If you buy a service from a hospital of giving you the correct blood result and the reports had error, okay, your blood reports from the laboratory of the hospital had some errors, it was not showing the correct result, it's not a good quality. So the basic objective is what the product or service is supposed to do, for what features people are paying you. Okay, that feature should be intact. At the same time, the product should not have any issues. Okay, your reports are fine. Okay, your reports and everything is error free, but the pages are torn, pages are of bad quality. Okay, that also will be a minus point in the quality. Okay, the thermometer is working fine, there is no issue, but it came in a very bad packaging. Okay, it was handled not with care, it came in a very bad packaging. So again, that is a minus point. So it should be deficiency free, and it should be doing the features, it should be completing the features that it is supposed to give you. Okay, so that is the features of the product or service. Customer satisfaction in today's day and age, this is gaining a lot of attention. Okay, to satisfy your customers are the ones who decide what quality is. Okay, it's based on their needs, based on their vision. Product and services are created today. Earlier it was not the situation. Earlier industrial revolution was such that mass scale products are produced and everyone has to use the same thing. Okay, on a mass scale, products are produced and that is what the customers should be happy with. But now the customer will tell what changes they want in your product. Okay, so now this is the era of total quality management. Earlier, during the industrial revolution, products that were defective, products that had error were not sold. Okay, all remaining things were sold, but now it is not like that. Now the customers are the key pillar in deciding what kind of product or service should be produced or sold, what features should be there in the products and service. So who is a customer? Customer is a person who uses your output. Okay, whatever is your output, if it is a product or a service, whatever you are selling, the person who is using your sales are your customers. Okay, they are the end user of your output. And in hospital, in healthcare system, a patient who comes to the hospital is the end user of the treatment. So patient are considered as customers. And in hospitals, you have two categories of customers, internal and external. Internal customers are your patients. Internal customers are your staff working for the hospital. External customers are your patients. Okay. Coming to the quantum of quality, quantum of service, cost of service, quality, small q by capital Q, customer satisfaction. Okay, these are the main components of quality. So what do you mean by quantum of service? If a doctor, for example, sees only 3 patients per day during their OPD timing, the doctor has an OPD time of 5 hours, let's say, and in that 5 hours, he is only seeing 3 people, 3 patients, but the quality of treatment given, diagnosis done is absolutely fine. Okay, but only 3 people are being taken care of by the doctor. Okay, here the demand and the supply is, there is a big gap, so it's not a quality performance. Okay, next is cost of service. Just because you are giving a good product does not mean you can charge whatever you want to the patient. Okay, whether the customer is getting the perceived value of the product or not, it should be affordable to the customer in the first place. Okay, you should not give extremely expensive product or service, okay, which has some quality as well, but if it is not affordable for the customer, how will you make profits? Okay, then quality products and services that totally satisfy your customer needs and expectation in every respect on a continuous basis. It is like ongoing process. Okay, not just for us for right now. For right now, we have launched a product and service. It's working fine. Okay, no need to do any improvement. Let's run this for the next 10 days. Sorry, run this for the next 10 years. It's not like that. With changing time, changing demands, changing periods, changing pandemic, epidemic, okay, quality will change. Then customer satisfaction. Whether your customers are really satisfied with the kind of products you are giving or not, that is very important. Always keep on researching this. Then is your feedback. Feedback is a very important component of quality control. There are different areas of feedback. First, we'll see what is exactly feedback, what is the importance of feedback. Okay, you will discover your customers' satisfactions, dissatisfactions when you do feedback studies. You will understand what is the priorities of the customer and what is the priorities of the organization. Is it the same or not? Compare the performance with the competition. Okay, how you are performing and how other hospitals are performing in this particular area of quality. Okay, for that, feedback studies are good. Identifying the customer needs, where you are falling short, where you have to work more on. Okay, determining the opportunity for improvement. So feedbacks have all these different systems in which you can collect the information. First is comment cards. So just for example, when a patient is moving from ICU to general ward, you can give the patient a comment card to comment on how the care was there in the ICU. Okay, when the patient is being discharged from the general ward, you can give them the comment card. How was the service in the general ward? Okay, so comment cards are used for that. Survey is a little bit costly. Okay, you have to find a group of people, give them questionnaire, collect data from them. Survey is usually done on large group of people. Okay, the larger the group, it will be costly. You will have to spend money. Then you have focus group. If you want to introduce a new service or want to install some new equipment in the hospital, okay, on a certain day, which particular types of patient is visiting the hospital, okay, what are the valuable opinion on the basis of which what kind of services can we introduce. Okay, this is focus group. You are not taking data from all the patients who are coming to the hospital. Your focus, is on a specific group of people, maybe for a specific department or so. You take data from them, okay, and you manage to do your to do your continuous improvement. Then toll-free numbers, free phone numbers without cost, it can be used to collect feedback from the users. Customer visit, you can go out to the customers. For example, go to a corporate industry where the corporate industry is already getting some health schemes from you. Go to that corporate industry and sell them your new services. Okay, and find answers from them. Are they happy with the services given to you? Okay. Report card, this is also a follow during the follow up. You can use report cards when the patients are discharged, when they come back for follow up. At that time, you can give them the report card to place their valuable comments. Then internet, anyone can go to the Google, can search a hospital on Google and put a Google review. Okay, that is internet, the use of internet. Employees feedback, not just your patients, but you have to see what your employees also have to say about your services. Okay. Customer care, how to take care of your patients, what should we do for customer care, how can you improve your public relations. Okay, these things are found out from the customer care department. Communication, you have to be involved, that you keep both the parties satisfied with the communication. Okay, both the parties will have the same platform to express themselves. Optimize the trade-off between time and personal attention. Minimize the number of contact points. Provide pleasant and enthusiastic employees. Write document in customer-friendly language. So these are the points you can keep in mind. Frontline people, when you are hiring reception staff, PR staff, uh, people who will be managing the bill desk, okay, insurance desk, people who will be managing the MRD desk, okay, front desk. So what kind of people you have to hire here? Hire people who like people, okay, they want to learn new things, give them the authority to solve problem. Okay, you have to treat frontline people also as internal customers, train them in proper basics of language of communication, reward them for their performance, good performance. So coming to the organization of quality control system in a hospital, quality management system, there are three major areas of quality management system. Okay, when you are introducing it, first is organizational analysis, or we call it as SWOT analysis. Okay, you have to understand where you are lacking behind, or what are your strengths, what are your opportunities, what are your threats. You have to understand that before involving any management system. Okay, second is training your training the people, top management, middle management, all the other staff. Everyone will be trained on how to use a quality management system. It's like a software. Okay, so when you're introducing a new software in the hospital, everyone has to should know how to use it, how to log in, which page they have to go, what they have to type in, which area they have to use based on their department. Everyone will have their own training in that. Development of quality control manual is also done. Every department will have their quality control manual based, which will have the SOPs on how things should work within the hospital. So organizational analysis is just SWOT analysis, basically SWOT analysis: strengths, weakness, opportunities, and threats. Developing hospital information system. Now, hospital information system is another software. When you're introducing hospital information system, you have to be sure of certain standards. Standards of physical standards, process standards, output standards. Okay, so physical standards or standards of structure, what you should know about. Okay, number of beds, what are the number of beds available? How are they utilized? Okay, are they overutilized, underutilized? Okay, personnel, how many staff do you have in your hospital? What are their basic qualification? Are they all trained well? Okay, level of motivation in the staff. Equipments, how many well maintained equipments you have, how many equipments you have which have broken down or not in use. Okay, supplies, do you have adequate supply? Are you getting out of say, is the inventory getting emptied? and you have to wait for the staff to bring the new package to treat the patient. So that is supplies. Space, do you have adequate space that meets the minimum standards of hospital maintenance? Rules and procedures, does every department have their own rules and procedure, and is it being followed or not? Okay. Technology, are you still using obsolete or technologies, or are you advancing with time? Finances, are you properly allocating your budget? Okay, are you utilizing the budget properly? Are you making profits? Okay, these are the structural standards. Then process standards, process is when the hospital services is interacting with the patient. So doctor patient interaction, the quality of doctors and patients interaction, art of care, the kind of care given to the patient. Okay, how you technically manage all the cases, how efficient is your staff, how are you documenting? Okay, is every step taken on the patient documented well or not? Interpersonal relationship between the healthcare workers and the staff. Okay, how many conflicts happen on an average? How many grievances of the patients are addressed on an average? Okay, what techniques and procedures are available in the hospital, and are they appropriate to the standards of any accreditation board or local quality control boards? Then you have standards of outcome, quality of work done, that is how good the service was. The patient will answer this. Quality of work done, was it optimum, minimum, or maximum? Did the patients get maximum quality out of the money they had put in, or they got only very less quality of service from the money they had put in, or based on what they have paid, adequate amount of quality was given? Okay, cost of care to the patient and hospital operation cost. This patient will also answer, hospital finance will also answer this question. Okay, customer satisfaction or consumer satisfaction, again the patients will give you the answers of all these areas, so that becomes your standards of outcome. This is the outcome of your service. Okay, next we have medical audit. In medical audit, it is defined as the evaluation of medical care in retrospect. Medical care and everything is already given. Now you go back and study how was it given. That is a retrospect study. Okay. It is a review of the professional work in the hospital, or in other words, the quality of medical care given to the patient. Okay. Studying it. Okay. How good was it? How bad was it? Okay. It is not punitive at all. It is not coercive at all. Okay, this medical audit is not done to punish someone or to force anyone. The purpose of medical audit is how can we improve our services for the next time? What can we learn from our previous mistakes? Okay. So prerequisites to medical audit, it should be carried out by fair and impartial clinicians. Some hospitals will get clinicians from outside their hospital to be impartial and fair to do the medical audit. Some hospitals will use their in-house physicians for medical audit. Okay, the impetus must come from the medical staffs themselves, which means the push to do medical audit. Medical staff should not put their hands on their head that medical audit is going on. What will we do? Okay, the enthusiasm should come from the medical staff. Okay, it's a good thing that audit is happening. We will know where to improve. A good system of medical record keeping and trained medical librarian should be available. A well-defined disease criteria should be used based on international classification of diseases. Okay, the coding system should be well defined. So these are the prerequisites of a medical audit. So that's about quality in healthcare organization from exam point of view.